Hi, I'm Semaan. I'm a licensed psychotherapist in the state of Virginia. If you've been to my channel before, thanks for tuning back in. And if it's your first time joining us, thanks for being here. If at the end of the video you enjoyed it, then please give it a thumbs up, leave a comment in the comments section below, and go ahead and subscribe to my channel so that you get notified when I upload more videos. I recently posted a poll on my Instagram account asking people for feedback on what topic they'd like for me to discuss. And an overwhelming majority of the people who answered said anxiety. So what is anxiety? Anxiety is a combination of cognitive symptoms and physiological symptoms that present together when we are faced with stressful situations. Some of the cognitive symptoms are racing thoughts, feelings of terror or doom, thinking of the worst case scenario, having irrational thoughts about the perceived danger, and your worry reaction is disproportionate to the actual trigger itself. Now, some of the physiological symptoms are tightness of the chest, muscular tension, headaches, nausea, even sometimes vomiting, shaking, trembling, sweating profusely. So all of the above symptoms, the physiological ones and the cognitive ones, together make up the word anxiety. It's important to note that yes, anxiety does sound scary, but it's actually necessary for human survival. It's part of our biological makeup. It's what keeps us motivated. It's also what saves our lives when we perceive situations as dangerous. So it makes us act on that flight or fight response. So our aim shouldn't be to get rid of anxiety altogether. In fact, I don't really think we can. So our goal here is to talk about anxiety and maybe some ways that we can cope with it. In the majority of people, anxiety can be controlled and managed in a way where the stress is recognized. However, it doesn't overwhelm that person's life. So they don't feel like they can no longer function normally because of those anxiety symptoms. However, according to the Anxiety and Depression Association of America, or the ADAA, around 18.1% of the American adult population is affected by an anxiety disorder each year. So that's around 40 million adults. That's a lot of people who meet criteria for an anxiety mental illness diagnosis. It's important to note that having anxiety and having an anxiety disorder are two very different things. Let's take the example of someone having a job interview coming up next week. And the reason I chose this example is because of the COVID-19 situation. This might feel very relatable to some people. So someone with natural amounts of anxiety may feel stressed out, may feel like they're looking over their resume multiple times, may probably even feel a little bit overwhelmed about it. That's natural, right? That's the anxiety that's essential for our survival as human beings. However, someone with an anxiety disorder may have a very different experience. What happens in anxiety disorders is that sometimes we feel that we're no longer in control of our lives because of the stressful situation coming up. So someone with an anxiety disorder may perceive the job interview as extremely overwhelming to a point where our eating habits can be affected, our sleep habits can be affected, where we feel like we cannot adequately manage the rest of our lives with that job interview coming up next week. So really, it's more of a debilitating situation for a person with an anxiety disorder because it is extremely hard to control. One thing I'd like to mention is that anxiety disorders are not just one type. According to the DSM-5, there's actually a few disorders that fall under the anxiety section. So some of those disorders are separation anxiety disorder, selective mutism, specific phobia, social anxiety disorder, agoraphobia, substance or medication-induced anxiety disorder, generalized anxiety disorder, and panic disorder. So as you can see, each person's experience with anxiety can be different depending on what diagnosis they actually have. As you're watching the video, if you felt like you identify with a lot of the things I said about an anxiety disorder, and you feel like you want to learn more about whether you have an anxiety disorder or just natural amounts of anxiety, then ask yourself this question: how long have your symptoms lasted? In adults, to meet the criteria for an anxiety disorder diagnosis, your symptoms must be there for at least 6 months. So that's an important distinction and an important reminder that not every time we experience anxiety, it means that we have an anxiety disorder. So now if you're looking back at your symptoms and you're feeling like, yes, I think they've been there for longer than 6 months, and I'm experiencing a lot of the things that were talked about in this video, then what are my next steps? The first thing I recommend doing is going to your general practitioner, the doctor that does your annual physical checkups and the one you go to for any medical questions or concerns. The reason for that is because you want to rule out any possibility of an underlying medical condition that could be causing your symptoms. For example, people with heart conditions may sometimes experience situations and feelings similar to the ones found in panic disorder. The tightness of chest, the nausea, the tingling and numbing sensation. So you really want to make sure these are not better explained by a medical condition. So now that you've gone to your doctor, what's the second step? Here is where you start looking into mental health professionals, either a psychiatrist or a licensed clinician, licensed clinical social worker, licensed professional counselor, licensed psychologist. So any of the disciplines that can accurately assess and diagnose a mental health condition. So after you've gone to the licensed clinician and you find out, for example, that you have an anxiety disorder, what do you do next? Here is where you seek treatment. And treatment can be in 2 forms or a combination of both: psychotherapy and medication management, or a combination of these 2. Psychotherapy is when you go to a licensed clinician who can provide talk therapy or counseling. The reason that can be helpful with anxiety disorders is because the therapist can really teach you techniques to combat that anxiety and to replace the anxious thoughts with more rational, clearer thoughts. Psychotherapy can also help you identify triggers, and you can also learn coping skills to deal with that anxiety. Medication management comes in when you feel like your symptoms are too overwhelming to even engage in therapy. So someone with chronic panic attacks may feel like they don't even have room or space or energy to engage in psychotherapy. So they might want to take care of those symptoms first before going to a therapist's office and starting that process. I'm going to share with you some things that you can do to help combat anxiety. A lot of them are things you probably already do anyway. Eating well-balanced meals, exercising regularly, taking a shower, brushing your teeth, taking a break from triggering situations. So these are all things we can all practice together. However, the key here is to do them with more intention behind them, or in other words, to do them more mindfully. Sure, I take a shower every day. That's part of my automatic process. However, when I'm dealing with anxiety, it's probably a good idea to take a shower with the intention to relax. So instead of just taking a shower, I can tell myself something like, I'm doing this to take care of my body, to take care of my soul, to help me breathe fresh. So these are some of the things, the positive self-talk you can do and put intention behind each of your automatic actions. Another tip I can share is to avoid substances like alcohol and caffeine. The reason for that is because they affect you physiologically in a way that could possibly trigger a panic attack. The last and most important tip I can give you is practice self-compassion. The reason for that is because anxiety can feel very debilitating. Whether it's an anxiety disorder or not, it can feel overwhelming to deal with it on your own. So just remind yourself that it's okay to feel anxious, and it's natural to feel anxious, and you're doing your best, and that's good enough. The takeaway message for you all is get help if you need it. It doesn't matter if you have an anxiety disorder or not. If you're struggling with anxiety and you feel like you would benefit from professional help, there is no shame in seeking that support. They're there for that reason. Thank you so much for watching this video. If you liked it and found it helpful, then please go ahead and give it a thumbs up. And if you still have any questions or concerns, or if you have suggestions for future videos, then please leave a comment in the comments section below. If you haven't already done so, subscribe to my channel for future videos. Thanks, and I look forward to seeing you all in my next one.